Bismillahirrahmanirrahim. The regulation of aldosterone secretion is discussed in this video. The regulation of the aldosterone secretion is tightly linked with the extracellular fluid electrolyte concentration, volume of the extracellular fluid, volume of the blood, arterial pressure, and renal function. So, zona glomerulosa controls this aldosterone secretion, and this regulation is independent of cortisol and androgen regulation by the zona fasciculata and zona reticularis. Four major factors regulate aldosterone secretion: increase intras, increase extracellular potassium, that is the strong stimulant of the aldosterone secretion. Even a small rise in potassium concentration can increase the aldosterone several fold. Increase angiotensin II concentration in the extracellular fluid, that is the renin-angiotensin aldosterone activation. The strong stimulus via the renin-angiotensin aldosterone system is triggered by low blood flow to the kidney or sodium loss. Then increased sodium concentration in the extracellular fluid. So a slight increase in sodium decreases aldosterone secretion. That has got means that has got a weak inhibitory effect. ACTH hormone, it is necessary for testosterone secretion, but it has got a minimal role in controlling normal secretion rates. So in this aldosterone effect, or the feedback control mechanism of the aldosterone, there this enhances potassium secretion by the kidney and increases sodium reabsorption, which rises the blood volume and arterial pressure. This restores normal renin-angiotensin-aldosterone activity, forming a feedback loop. So most potent regulators are potassium ion concentration and renin-angiotensin-aldosterone system uh, that regulate this aldosterone secretion. So to remember is that these aldosterone secretion is tightly linked to the body electrolyte balance, blood volume, and blood pressure regulation, primarily controlled by potassium level and renin-angiotensin system. So these graphs are showing the uh, first, the upper one is showing this plasma aldosterone level that is shown in nanogram per 100 ml. The control is about 45 nanogram per 100 ml, and that is on the y-axis. And on the x-axis, there is a control ACE inhibitor, and then ACE inhibitor and angiotensin infusion effect. So aldosterone is high as control. It is about 45 nanogram per 100 ml. When ACE inhibitor is used, aldosterone drops significantly. This is about 27 nanogram per 100 ml. And when ACE inhibitor along with angiotensin II infusion is given, so it again increases, this aldosterone secretion increases to about 41 nanogram per 100 ml. So ACE inhibition or angiotensin converting enzyme inhibitor uh, use, it reduces aldosterone secretion by reducing angiotensin II formation, and angiotensin II infusion overrides this inhibition, raising the aldosterone level again. While here in the lower graph, the plasma cortisol concentration is given in microgram per 100 ml. So normal control is about 0 to 3 per 0 to 3 microgram per 100 ml. When The control is 1.2 microgram, and when ACE inhibitor is given, the cortisol rises slightly. It goes up from 1.2 to 1.5 microgram per 100 ml. And when ACE inhibitor with angiotensin 2 infusion is given, cortisol returns to 1.2 again to the control level. So the cortisol levels are relatively unaffected by changes in the renin-angiotensin-aldosterone system, unlike the aldosterone. So there is a role of angiotensin 2 in the aldosterone secretion. Angiotensin 2 is the primary stimulator of aldosterone secretion, especially during reduced sodium intake or decreased uh, extracellular fluid volume. So this is evidenced by blockade of angiotensin 2 formation by ACE inhibitor that caused a marked decrease over here in this diagram in the plasma aldosterone concentration, and while cortisol level remains relatively unchanged, confirming that aldosterone regulation is strongly linked to the renin-angiotensin aldosterone system rather than the cortisol control. Then the sodium ion concentration has minor role in regulation of the aldosterone secretion. A 10 to 20% decrease in extracellular fluid sodium ion concentration, that is a rare condition, can increase aldosterone secretion by 50%. The adrenocorticotropic hormone or ACTH has got a permissive role in the secretion of or regulation of aldosterone secretion. A small amount of ACTH from the anterior pituitary are necessary to enable the adrenal gland to secrete the required aldosterone, and total absence of ACTH can significantly reduce aldosterone secretion. So ACTH is not a major regulator but ensures the baseline secretion capacity of the aldosterone. So to summarize, we can say that angiotensin 2 is the dominant regulator of aldosterone, especially under low sodium or reduced extracellular fluid volume. Sodium concentration and ACTH have secondary or supportive role in the regulation of the aldosterone secretion. Thank you for watching this video. If you have any query, please write in the comment box.